The CDC is out with updated guidance on how to live with this virus and reflecting a new stage of this pandemic. We'll talk about masking, how to tell what the level of community risk is in your county and what this means for you. What their new guidance says is that for approximately 70% of the counties in the United States, they can now go without masks in certain indoor settings, including the classroom. This is reflected by their shift in focus away from daily case counts and to the metrics that really matter for us as a society. So what is that? Our hospital capacity, our healthcare system infrastructure, how many hospital beds are available, what the emergency rooms look like, and how many ICU beds are available. So that will be the focus going forward, much more so than daily case counts. So how do you determine if you should wear a mask in indoor settings? You should go to the CDC website, cdc.gov. There's a tool on the website based on your county and breaks it down into community transmission risk, low, medium, and high. If your county is at low risk, you can go without a mask. If your county is in the middle area, medium risk, and you have certain medical conditions, obviously if you feel more comfortable, then you should go back to wearing a mask or continue wearing a mask when indoors. And if your county is at high risk, you should be wearing a mask. The point here is that as we move forward, there will be certain checks and balances in place so that we can pump the brakes if we see certain metrics starting to go up, and we can relax a little bit if we're in a low risk area. If your county falls in a high community risk zone, then yes, you are required or recommended to wear a mask in indoor settings, even if you are fully vaccinated. So what if you're unvaccinated? We're moving to a point now that the CDC is no longer distinguishing their recommendations or guidance based on vaccination status. That may be subject to change in the future based on the emergence of new variants or community risk and transmission level. What about a group of the population who is heretofore unvaccinated and not yet eligible for the vaccine? So we're talking about children under the age of 5. If you are a parent or grandparent or caregiver for a child in this age group, the best way to protect this age group is to provide a buffer or circle of protection around them. That means with people who are fully vaccinated, boosted, or in some cases, people who have had both the vaccines, the booster, and have also been naturally infected with COVID-19. As always, as we've said multiple times throughout the course of this pandemic, the guidance coming from the CDC is subject to change. We are learning more about this virus and how it behaves here in the United States on a daily basis. And at this time, the best way to protect yourself remains vaccination and boosting for COVID-19.